All right, welcome back. I'm your host, Michael Stamatinos, the Advancing Healthcare Innovation Show. And if you're new to us, we are crazy passionate about healthcare innovation and adoption. Our aim is to bring stories of innovation within leaders within space, highlighting real people that are really truly innovating within the environment. And look, we've got an action-packed year. If you haven't checked out any previous episodes, highly encourage you to subscribe wherever you're ingesting this information from. Super duper excited today to have Randy Forman on the show, Chief Commercial Officer for Path. Randy, welcome to the show.
Thank you, Michael. Great to be here.
Yeah. So, before we kind of dive into all this stuff, I've said this numerous times before, but there's really two things that I care very, very deeply about in this world. One, access, and access can be defined in many different ways. And today, I'd love to be able to kind of explore what you guys are doing to kind of promote access within the behavioral health space, but then also leadership and just kind of learning a little bit more about your story. I know your background's super interesting. So maybe you can dive into initially early on, maybe even early days when you were throwing sliders and fastballs and striking batters out. So maybe kind of go from there and we can just kind of jump into a few different things.
Sure. So, I'll go all the way back, born and raised in Albuquerque, New Mexico. So I was the Jewish kid there, and spent about 15 years and then graduated high school in West Texas. So kind of a unique place for somebody with my background, but public school kid, played sports growing up, and, baseball was the thing that sort of stuck. In high school, an 85-ish mile an hour fastball, good enough to get you looks at various colleges. And I didn't have, I didn't know a lot of folks that went to, big national universities, went across the country to school. It was a lot of local options, everything from junior colleges in Texas to, state schools. Through just a series of fortunate circumstances and fate, I ended up having an opportunity to go and play baseball and pitch at Yale University. And there's a whole story there. But, when I was first asked by a former captain of the Yale baseball team if I'd ever considered going to Yale, I think I responded, "Where's that?" Because I had no idea. And so, who knew? The one school I applied to, I was fortunate to get in, and, just an amazing opportunity to learn and grow and meet some of the best people that I've ever met, and some of my closest friends still today, and starting to see some of those people rise into interesting roles in business and in politics. I will likely be a former teammate of a presidential candidate in the next campaign, so that should be interesting. I don't know if I'll vote for him, but yeah, so, fortunate to have that experience. And then, to graduate in 2000, went to work. And I actually joined a technology startup based in Phoenix, Arizona. So I was a network engineer for first couple of years of my career, and not a lot of technology background. So some of the, technology and engineering folks that I work with today find that hilarious that I was actually a certified network engineer. Always gravitated though to sort of the client relationships. So I still remember the CEO of that first company, which was called Calence, and it was later acquired by Insight. Kind of pulled me aside and just said, we got to get you into sales someday, because I was on one of our largest client projects. I was with American Express Financial Advisors. They probably made up about 60% of our business.
Wow.
And, there was one guy there who controlled the purse strings. He was a guy that nobody talked to. You didn't want to take a chance of disrupting the relationship there. He was a former baseball player, and took a liking to me. And, before you know it, I'm helping coach his son's Little League team, and built a great relationship. And, the whole time I could sort of feel my executives cringing at the thought of this, 22-year-old with the gravity of like 60% of our revenue in my hands. But, so then when I had the opportunity, bubble burst technology in 2001 wasn't the best place to be. And so I started thinking about what was next for me. And, through the Yale network and some relationships that I had, I found my way into medical sales, which brought me to Chicago. and sort of the rest is history. So spent a few years with a company called Aspen Medical Products, which makes, neck braces that you see on TV all the time, and kind of cut my teeth selling into, trauma departments, ER, purchasing, neurosurgery, orthopedic surgery. Walking into doctors' offices, doing lunch and learns, all that kind of stuff. And then a few years later, recruited to a company that was in the radiology display business called Dome Imaging, which was based out of Boston. And then they were acquired by a company out of Beaverton, Oregon called Planar. Spent, I think it was 9 years there in a variety of roles, ascending into sales leadership roles. So it was, capital equipment, hardware with some software. And then one of the engineers from that company went and started a really cool company called Life Image. And so this is sort of my first taste of enterprise software. And also it really got me closer to kind of the patient care, not only like solving problems that the patients had, also thinking about the physician workflow and some of their challenges. And like, as crazy as this seems, this like simple solution to solve this problem, which shouldn't be a problem, but people walking into doctors' offices with CDs of their imaging, or DVDs, I guess they are, and half the time they don't work. And, the doctor loads a CD and it's got some new software on it that they've never seen before. And they're in front of the patient trying to look like they know what they're doing. And, just a huge issue. So we solved this problem. We made it so that the CDs work every time, and also presented in the same software every time, so the physician was comfortable with it. And then you could actually share it electronically, push it right into your PAC system. And then, really cool stuff like being able to share imaging through the cloud. So if you're a trauma transfer, in the western suburbs of Chicago, and you need to, go to Northwestern, instead of strapping the CD to the gurney and sending it with the patient and then praying that it worked when they got there, they could actually send that imaging in advance of the patient arriving. So just amazing company, solving real problems. And so again, that got me really excited about just getting closer to the patient and the member experience. And that's what brought me to Livongo Health, or what became Livongo Health. So I joined what became Livongo in late 2013. So fortunate, a personal friend of mine had done a bunch of work with Glenn Tolman, who was his mentor, and got to know Glenn. And he brought me in, when they started Seven Wire Ventures. And it was interesting. I actually had an opportunity to join one of two companies. And one company was this, sexy app, 4 buttons, and each button was basically going to solve, all the problems that existed in getting access to your healthcare. And then the other was this diabetes test strip and meter company. And, without getting into all of it, the long story short, I had a feeling that Livongo was going to be the right place for me, and ended up spending, a bulk of the last 9 years there, through the IPO, through the merger with Teladoc, and then left at the beginning of this year to join Path Mental Health.
So it sounds like you've had your fair share of tour of duties, and each tour of duty, you take something with you along the way. What have you specifically taken with you going into Path, and what are you most excited about in terms of what you guys are trying to solve for today?
Yeah, it is interesting, because you see people that sort of specialize in an area of healthcare, and they kind of build their book of a business and their relationships, and they sort of leverage that throughout their career. I don't know if I just don't have the attention span for that, or I just, I like to meet a lot of people. I'm a networker and a connector. And so, I've sort of built and evolved my career. And again, I've sort of felt this pull to solving real problems that actually touch, the patient or touch the provider. And so that's what I get excited about. I love the idea of just optimizing. I think about this even in just the way that I work. If you find the tool that makes something that sucked to do, like, easier to do. I use Expensify as an example. They took this thing that nobody's ever enjoyed doing their expense reports. And there's something about the experience that they create they say it makes it suck less, but there's actually, like, creates a little bit of joy when this thing that you expected to not work or not work well or be painful is not. And so, you know, I think in healthcare you can like think about these big swings in innovation, but you can also solve what are kind of fundamentally really small problems that can have a huge impact. And so that's actually what drew me to Path. I got to know the Path founders. I think I met them about 3 years ago, and they were just starting the company. And the initial idea was to focus on mental health, but with a specific focus on alcohol use disorder, substance use disorder, and solving a couple of problems. One, you have these treatment facilities around the country. I don't want to say there are some really high quality treatment facilities around the country, and then there are some that are that do spend a lot of time trying to pull you out of your network, $25,000-$30,000 pop. And unfortunately, some of those lower quality centers, and it's a revolving door. So patients end up in and out of those facilities, driving significant cost, poor member experience, and ultimately the payer, whether that's the insurer or the employer, is bearing the cost. So that's first problem. Let's go solve that. And then let's create better access to care generally. And that's sort of what got them down this path. No pun intended. Path evolved over the next couple of years. They decided to broaden out and focus on broad behavioral health. Just about everything that you can treat from a telehealth perspective, we're able to handle. And that requires some of the case management or care coordination that some of the just pure talk therapy companies don't do. So they sort of evolved this model. Let's kind of treat the whole person from a behavioral and mental health care perspective. And the ultimate goal is let's create access. Today in our country, 65 million Americans suffer from a treatable mental health illness. So it's 1 in 5 Americans. And the demand for these services is increasing, obvious given what we've all gone through over the last couple of years. So you have increasing demand, you have limited supply, and that's exacerbated by the fact that let's call it half, just for round numbers, half of mental health providers in our country today don't take a single commercial insurance. And why is that? It's a lot of work. And so for a small office, to deal with credentialing and to deal with, claims and claims denials and marketing your business. It's
reimbursement too. I mean, sometimes reimbursement is just, you're not getting paid what you feel like you're worth.
Yeah. So you have this other issue where sort of the reimbursement rates that you see across a lot of the commercial plans, there's a big gap between what those providers can get today in a self-pay, cash pay world. So that, for some of those providers that are full and making a couple $100 an hour, they've got a nice business. The reality is that it creates a stratification between the haves and the have-nots. And so, what can we do to increase access to these specialists and get it covered by insurance? And so that's been sort of the Path model. There's a number of folks solving access in different ways. There's, for subclinical, there's lightweight digital, there's coaching, or there are folks that are, more of a cash pay model, or that are kind of carving out, building their own network and selling it directly to the employers, which is sort of what we kind of we created this momentum with Livongo. Kind of, if the existing ecosystem is not solving this problem and you as an employer who has these levers want to do something about it, we can come in and we can do that directly. And that was great 7-8 years ago, but now you have a point solution for literally everything you can think of. And that's just created more fragmentation. The buyers are overwhelmed. They can't manage all these solutions. The care is not integrated and coordinated. So if you've got somebody who's, it's hypertension and diabetes and they're overweight and they're depressed, and you have 4 different solutions that your employer is offering, kudos to them for actually doing that and providing these services. But, if you're the member, that can be a pretty confusing experience because they're not coordinated and they all have their own interests. They all want to keep you engaged in their program. And, so there's been this wave of kind of carving out, and the Path model is like, this is supposed to actually work. The Mental Health Parity Act in 2008, not necessarily from an access perspective, but sort of how it's treated from an insurance and copay perspective. You're supposed to be able to find a provider covered by your insurance. It should just work. And, I use the example, I don't know if it's a great one, but, if 10, 12 years ago, you could, in New York City, know that you could get a car right where you wanted to, and you could know that the driver was a good driver and the car was clean, and you could pay for it on your phone. Like, do you need to create this whole other system, the Ubers and the Lyfts of the world? Maybe, but maybe not. And so, can we do that here? This is supposed to work. So if we can actually increase the supply of providers who can take insurance, and we bring our providers into sort of our network. We have national contracts with all the major payers. So we're in 9 states today: California, Illinois, Florida, Georgia, Texas, Virginia, Ohio, New York, and North Carolina. So when we bring a provider onto the Path network in a particular state, we basically get them credentialed in with all of the plans that we have relationships. So for somebody that is referring care, for example, a care coordinator or a discharge nurse at a health system, or even, a PCP who's just trying to, they know that their member or their patient needs support. They're trying to get them there today. They just send them off into the ether, or they go to the insurance portal and they try to curate a list for them. And then the member has to call 20 providers. And so,
they're putting the onus on the member, but I just want to back up a second, because you said some things that really struck a chord with me, and I kind of want to elevate a little bit more. So we talk about innovation and how there really hasn't been a better time to be innovating within healthcare. And as much innovation is happening, I think it's actually causing a little bit of a problem, in the sense that it's creating this whirlwind where people kind of get stuck. And I'm curious, in terms of what you guys have been able to do, how have you innovated through that, in the sense that you've been able to cut through the noise and you kind of touched on it before about really solving the problem. These last 24 months have been bizarre, uncertain at times. I guess if you could kind of put your finger on something,
sure,
just in your time and what you've seen, what is that? And can you maybe crystallize it by maybe giving an example?
Yeah, so, again, there's different ways to kind of solve problems, and innovation is often a way that we sort of solve a problem. But adding more technology is not always the right solution, right? And so, one of the things that's been interesting at Path, and by the way, there's a number of different directions that we could go to increase access, even more than we're doing today. We could have digital kind of self-guided content. We could have coaching, but the reality is there's so many folks that need traditional therapy, and we know that therapy can be delivered effectively via telemedicine. And so, again, there's these things that are just broken today. You go to the payer portal, you search for a provider. They don't have any real-time visibility into that provider's calendar. Oftentimes those providers are either full, or maybe not even taking that insurance anymore, so that the systems aren't synced. And so, as simple as leveraging our own EHR and basically mandating that all of our providers are on that system, and that gives us access to real-time visibility into their calendars. And so, the Path experience is not that different from OpenTable, where you search for what you want, you see the available tables at the available times, and you book right there. It seems like it should just work that way, but it hasn't. And so, again, we're not doing anything create, I mean, there are some things that we do that, better than others. Being able to build a network is really hard. Building a high quality network is hard, but like simple things like just making it easy for the member to find what they're looking for, see that availability and book it right then. Like, what a novel concept, right? It's just working the way it's supposed to. And there's, again, I'm simplifying it. There's, we now know that if you have demographic sort of preferences, like you want somebody that looks like you, talks like you, has similar life experience, and we can actually match you with that person, that drives an even better outcome. So it's, let's create access covered by insurance. But if we can actually match you to the right person, we know that's going to drive even better outcomes. So like, that's kind of how we're innovating. And again, we're not creating, AI chatbots that are solving, mental health issues, but you don't have to right now, or at least there's just so much need right now that if like, there's just a huge problem that we can solve here, and that's what we're doing.
Look, you're innovating in the areas that you know that aren't going to be changing, meaning patients are always going to want to get in to be seen expeditiously by a provider. They're always going to want to be treated nicely. You're not going to hear someone that's going to say, you know what, I want to see someone in 6 months from now. Normally they have a problem. They want to be treated immediately.
Yes.
And they're not going to want to be treated either, poorly.
Yep.
They're going to want to have a really pleasant experience. I mean, healthcare is about human to human interaction.
We live in an on-demand world. You can order almost everything you could ever want from your phone, and have it there in a day or two. And so, we hear of, 4 or 6 week wait times for folks. And, a lot of stuff, we're not a crisis line. We're not dealing with, patients that are suicidal, non-acute stuff. And, but some of those patients want to be seen within 48 hours to a week. And part of it is maybe they don't need to be seen that quickly, but, you have somebody that has sort of worked through the stigma, maybe they've tried to do this before and they haven't been successful at finding anyone or finding the right match. And, so they're ready, they're leaning in, like, let's get them matched to that care right away when they're actually like leaning in and ready for it.
So you talked earlier when you kind of went through your core story about having an amazing experience at Yale and being very privileged to have that level of access. Fast forward today, what about some of the underserved and overlooked populations? How is Path thinking about and maybe even acting upon those ideas today to provide more access to the populations where we know that it's really critically needed?
Yeah. No, great question. I mean, the reality is, like, we're a 2.5-year-old company. Big picture, we want to create access for all Americans that need care. You have to start somewhere. You can't boil the ocean. And so, where we've started is focused on, commercial insurance. So making sure that people are cut, if you're employed, you have any of the major commercial insurances that we can work with you. We're not doing Medicare today or Medicaid, but ultimately that's the goal, is to create access for all people. I mean, we could take a patient who doesn't have insurance and it's cash pay, and it's probably significantly less expensive than what they might find down the street, but that ultimately, like, these folks do have coverage, but as creating access for Medicare, Medicaid patients is a complicated endeavor. And so, we will get there soon, but right now we're focused on, commercially insured 13 and above. Obviously there's significant demand for kids today. And so we're hearing a lot of that from our, health plan partners, some of the health systems that we work with. And so there's just so much opportunity to solve problems there that, we're trying to stay focused, but eye on the bigger picture for sure.
Yeah, it sounds like you're thinking big. You're starting small and you're moving quickly. So eventually you will get to some of those other areas of need and where it's needed. What is sort of the best way that, folks can follow your work and keep track of some of these awesome patient stories and successes and outcomes? And, how are those outcomes reported back to some of the payers that you're working with? I guess maybe talk about maybe some of those little wins, some of those little successes, to the degree that you're able to, without, breaking any kind of confidentiality.
Sure. Yeah. So, how to kind of keep up with what's going on. I mean, best way right now is let's just chat, and we'll kind of keep you looped in. Path is a fascinating company. I joke that it's probably like the fastest growing digital health company that nobody's heard of.
Until now.
Until now, right? They're just a real focus on execution right now. And, I know that, you'll see companies that they announce every fundraising round, they announce every hire, they announce anything they can announce. And, I've been a part of a playbook like that, and it's great to have press and create awareness. But I can't argue with kind of what I'm seeing and how this team is sort of just focused on pure execution. And so you won't find a lot about us out there, which, for what I'm here to do, which is to be one of the few people that's out in the market and creating some of these partnerships. It creates some challenges. I think we'll start to be a little more kind of corporately vocal over time. But, in terms of sort of like the feedback loop with existing partners, the reality is Path exists today as like a partner for anyone in the states that we're in today. So any health system, any digital health company that's coordinating care, any employer for that matter, they have us today. They actually already have access to us today. So again, it's like OpenTable exists. You can go through the phone book and calling restaurants, or you can just go to OpenTable. This service exists. We don't charge anything to those partners. So it exists. They could, and many of them do, refer patients to Path, or members of an employer find Path. They go to the insurance portal, they start calling providers, and then they end up calling one that rings to us. And so they're all using us in some way today. But what we can do in setting up, I'll use air quotes, but a partnership is make it so that we can track what's actually happening. We can provide some materials that, so they can sort of formalize and create a process for how they want to refer patients or coordinate care. They need outpatient therapy. How do they make it really easy for the patients to find us first, kind of going through the yellow pages first? And then that allows us to track, where those patients or those members are coming from. And, we really focus on driving true measurement-based care, which historically hasn't really existed a whole lot in outpatient therapy. And so,
which is a little surprising, by the way. I mean, how do you not measure
individual practitioners? There's sort of art and science to this, and I think that there's maybe some pushback that I don't want to be sort of forced into a particular modality, or kind of ask people to fill out the PHQ and GAD surveys every so yeah, it just I think I saw a stat. It's like less than 5% of outpatient therapy providers actually do this. And so really kind of implementing that, and that allows us to create this feedback loop to the people that refer to us. So a health system that is, yes, you sent a patient to us. Yes, they were actually matched, scheduled within 48 hours. They're seeing their therapist. They've had this many sessions. They're still in care. Here's what we've seen in their outcomes. Maybe they got better, right? Yeah. So this other problem in the system today is that, therapy doesn't have to be a lifelong thing, or, maybe people kind of go in and out and have that support system. But, if you get better, let's let you move on with your life until you need help again. And let's open up some of that access for other folks. But so we're sharing all that data back. We can share in an aggregated way, or if we have all the legalese in place, we can share de-identified data back to those partners with the members' consent, of course.
It's pretty fantastic. I think there is something to be said about innovating, and in order to innovate, you really have to execute. Otherwise, you're just talking. So, personally, I'd rather have a whole entire community of executors that are focused on solving problems, as opposed to just regurgitating and, telling the world how good they are. Let your
Yeah.
customers tell you how good you are. Let your referral source tell you how good you are. It's because your head's down and you're really, really focused. So I just want to say that I applaud Path for taking that path. That isn't the easiest road to take. It's the road less traveled. And
Yeah. Yeah. So I
it's
mean,
easy to
again,
just use the word path, by the way. We're just
yeah, I know,
overusing
I know, I do that all the time. Yeah, I mean, again, there's different ways to sort of to get to the same goal, and I've been at companies that have PR machines, and you put it out there enough, and you kind of will it into happening. And the reality is, like, this problem we're solving is, like, I don't have to sell, I'm not actually selling anything, and I don't have to sell anyone on this. Like, if people understand that we are creating access, like, we could just stop there. Just creating access to these professionals is a huge win for anyone who's connected into the healthcare ecosystem today. They all know that, like, whether personally or professionally, you try to find a therapist, it's really difficult, and it doesn't have to be. So yeah, like I said, I'd like to be more vocal, and I think you'll start hearing about us a little more soon. But yeah, we've a lot of our kind of referrals for some of these partnerships come from some of the work that we're doing with some large health systems in Southern California, who they've been using the yellow pages, and now they've got OpenTable at their fingertips, and creates a better member experience. It saves them a ton of time and work. And so yeah, word of mouth is obviously super valuable when you have, again, some of these large nationally known health systems going and telling their friends. Makes it much easier because everyone thinks that everyone's selling something, which is the thing that I have to overcome. I'm like, I am not trying to sell you anything. Like, this thing exists. You're probably already using it. We go through some of these calls, and they're still like, all right, this sounds great. How do I get it? How much does it cost? I'm like, no, I really mean it. You already have it, and it costs you nothing. It's almost like, yeah, it's kind of funny,
it's
but
hard to value free.
It's a great point. You get something for services you're providing, and maybe we will, but the model works, and why, I don't know, why create additional barriers to some of the folks that need this. Maybe the model is that we provide some of these services that we don't get paid for. Some of the care coordination and kind of case management that we don't get paid for that. But we're demonstrating value, and at some point maybe we get paid for those services as well. But yeah, we're not selling anything to employers and to health systems and other digital health companies. But they can use us, and if we actually have a couple conversations, they can use us in a much more efficient way and actually have visibility into what's going on.
So before we close, because what I'm taking away from this is, it's about execution. If there's going to be one thing that you could have any of our viewers execute on after this conversation, what would that one thing be?
I mean, I think there's so many things that we're doing well. That's a good question. I mean, look, I think not sexy, and it's not even really the technology, but when you're in this side of the business, and we're much like a large group practice. These therapists they're not W-2 Path employees, or largely 1099 employees, but how you support them. So people ask, like, how do you do this? How do you get people to go from their $150 an hour, $200 an hour cash pay to coming onto the Path network? Our rates are not as high as that. And a lot of the providers, they start, it's like, I've got some open availability, let me try this thing out. And then over time, they start to bring their practice over. But if you read Indeed, I just point people to those reviews. Most of those reviews are providers, and you can just kind of pick up common themes. And again, it's not creating some, crazy new widget, and it's not some AI chatbot. It's just like real people supporting these folks. They're kind of starting a new venture. It might be the first time that they haven't worked for somebody else. And so, creating that support system, doing a lot of this work that they may not want to do or know how to do, and really knocking that out of the park, I think is huge. So, yeah, I think I've had many moments here where I'm like overthinking this. Like it's
keep it simple.
yeah, like there's just a lot of simple things that we can do better. And that creates this sort of flywheel that we've created, which is creating access and giving us, allowing us to demonstrate kind of the value that we're bringing, that allows us to go back to the payers and say, hey, here's the value that we're bringing, and we'd like to bring more value, and you'd like a larger network. And so, that gets us into discussions about more competitive rates or moving towards value-based care. And when we start to get more money from those payers, that allows us to go out and bring more of these providers back into the system.
Fantastic.
Yeah, I know that's
it's good. I mean, look, it makes a lot of sense what you're saying. Because you're just saying, look, the problem is so clear, and the path that we're going to take, sorry to say that, but the path that we're taking is one that most don't. And we're going to do it. We're going to do it extraordinarily well. And we're going to let the results speak for themselves.
Yep.
And when that tune keeps going, it's going to be difficult for people to drown that out. So,
yep.
Randy,
and then you start to think about new ways to create access. So, whether that's group therapy delivered via telemedicine, or again, lightweight digital, leveraging coaching. There's a whole bunch of things that we can do, but again, there's such a massive problem right now, and everyone's feeling this pain. And so we're like, let's just put our heads down, go solve this problem, let the results speak for themselves. And yeah, it's an amazing business, and we're helping people. We can get to see, I have a live feed of our NPS scores as they come in, and I read the comments. We're that close to the patient. We're seeing what we're doing, and it's pretty awesome.
It is pretty fantastic. I just want to thank you, and just to encourage you and the rest of the team at Path, that what you guys are doing matters. It's a significant, what better way to innovate within healthcare than to advance society at large through what you guys are doing, creating more access. And for those that are listening in and tuning in, I just want to encourage you, wherever you're consuming this content, hit the subscribe button now. I mean, would you mind even commenting or sharing it or liking it on social media? It's nice to know how people are engaging and feeling, the content that we're putting out there, and you found it helpful for you. We'd love to hear from you, and, tell some of your friends about it too. It's always nice to have more and more people that are about execution, about solving problems, and bringing more of these execution-oriented innovators and doers within our space, I think, is what's going to make things better. So I'm just grateful that you're here, and I'm looking forward to our next conversation.
Awesome. Thank you, Michael. Been great.
All right. You bet.